Hello and welcome to the latest edition of the Hillingdon Hospital's NHS Foundation Trust podcast. I am Jonathan Lowe from the communications team, and I'm delighted to say I'm joined by our Deputy Chief Nurse, Graeme Wright, to talk about the organisation's work in becoming a veteran-aware trust and what it means for patients and staff. So without further ado, warm welcome to Graeme, and thank you for joining us on the podcast. For those who don't know you, can you just start us off by introducing yourself, please?
Certainly. So good morning, everyone. My name's Graeme Wright. I am the Deputy Chief Nurse, and I'm the management lead for the Veterans Awareness work. In that work, I'm supported by Paula Wheatley, who's the clinical lead, and by Sarah Burton, who's our executive lead. And then we've got a host of champions. So we've got workstream leads, and these include people like Bob Street, our head of security, Helen Stewart, our lead nurse for quality, and Noel Burkett, our director of transformation improvement project management. And apart from myself and Sarah, all of them are either veterans or members of the armed forces community.
Yeah. Okay, excellent. And what does it mean then for the trust to be veteran aware?
So it shows our commitment to members of the armed forces community, whether they're patients or staff. For patients, it means thinking holistically about their needs. It means thinking about how their services affected them or the care that they need. And it's thinking about the other services that we might need to involve in their care. And there are lots of services that are dedicated to the support of members of the armed forces community. For staff, it's thinking about how we can support them with things like undertaking reservist activity or going on deployment, or for the spouses of serving personnel, thinking about how we can support them when their spouse is deployed, because suddenly they might have to do the school run 5 days a week, and previously they were only doing it 2 days a week. So we have to think about things like flexible working. So it's just about how we can better support and meet the needs of both our patients and staff.
Okay, and can you just tell us about the Armed Forces Covenant? That's something which the trust signed earlier this year.
Yes, it is. So the Armed Forces Covenant was brought into law, so it's statute by the UK government, and it's an enduring commitment between the people of the United Kingdom and our armed forces community. So it says that we will honour them, we'll support them, and we'll recognise their value as serving personnel, and that's both regular and reservist veterans and their families. Most importantly, it says that we'll work to ensure that they're not disadvantaged in relation to how they receive public services. And it applies to all of society. So it applies to the public sector, it applies to the private sector, it applies to charities. And it's really important, I think, that thing about disadvantaged. So if we think about, say, spouses of veterans or active service personnel, they might go onto an NHS waiting list for a procedure or an operation and work their way up that waiting list. And we know that waiting lists are often about a year. And then just, a couple of months before they're due to have their procedure, they might be redeployed somewhere else in the country, and they'll find themselves back at the bottom of a waiting list. And that can happen 2 or 3 times. It's not uncommon for service personnel to move around every year. And so for the spouse, that means that they never make their way to the top of the list. So what for most people would be a 1-year list suddenly becomes a 4 or 5-year waiting list for a member of the service personnel. So it's thinking about things like that and how staff and how they're disadvantaged and what we can do to kind of make up for that and correct that.
Okay, and just to be clear, then, so this is for this applies to existing personnel and veterans.
So it applies to all of the armed forces community. So that's active service personnel, that's reservists, that's their families, and it's veterans.
Yeah. Okay, sure. And obviously, we were recording this towards the end of June. The aim for the trust is to secure this first stage accreditation, and obviously there's various stages of accreditation. Can you just tell us about them and what they indicate?
Yeah, so there's kind of 2 branches to accreditation. So there's veterans awareness, and that's kind of a yes/no question. So we're hoping to achieve that relatively soon. And that tells us that we are a veterans aware organisation. So we are actively identifying staff and patients who are members of the armed forces community. So for staff, this can be done by updating their ESR record. For patients, it's done on Cerner. And at the moment, there is a field when patients are being registered, but it's not mandatory. It doesn't have quite the right questions in it. So we're working to update that. And then it's about thinking about how we can better support them. So thinking about making sure that we've got pathways for patients to access the right care. And at the moment, we're working on getting all of that information available on the staff intranet, so that when you're caring for these patients, you can see what services are available in the local area or what kind of bigger national services are, so you can link in after you've done your holistic assessment of those patients. And that's the veterans aware bit. So it's about being aware. And then there's the employer recognition scheme, and that's done on a kind of bronze, silver, gold. And that's about what kind of employer we are and how we link in with the Ministry of Defence around employment. So there are various stages to that. We're working towards bronze at the moment, and that's really just about making sure that we've got a kind of staff network for members of the armed forces community, which we're working on establishing, and about making sure we've got some policies in place that help to support particularly reservists, members of the cadet services, and active service personnel when they go out on deployment. And so most of our policies are already there, but we're just working on refreshing those and updating those. And then as that progresses, it just gets a bit more complex and a bit more detailed about the kind of work that we need to undertake. But that's about what kind of employer we are. So there's the being aware of veterans, and then the how good an employer we are for veterans.
Okay, so is the eventual aim for gold then, in the foreseeable future, should we say? Obviously, there's no point putting a time scale on it, but gold is the aim.
Gold is definitely the aim, but the immediate aim is just to get signed off as a veteran aware organisation and to get that first kind of bronze recognition, both of which we're hoping to do this year. And then we'll put in plans to hopefully quite quickly move up to silver and gold. Is something the Trust is really committed to and wants to do as soon as possible. But obviously, everything takes a bit of time, and also we want to make sure that we do things properly and we do things well. We don't want to just rush through it for the sake of getting a gold. We want to make sure that we've got proper systems and processes in place that actually do work and make a difference for people.
Sure. And I mean, you've already alluded to it somewhat, but in order for what staff need to be aware of in relation to this, then it's I guess it's making people aware, isn't it? As many people aware as possible.
Yeah, so the absolute most important thing is if you're a member of staff who's in the armed forces community, please update your ESR record. That's the most important thing, because that allows us to identify you as a member of the armed forces community, and then to make sure that you're getting the support that you need. And also to look out for information about the Armed Forces Network, which we're hoping to launch later in the year. And otherwise, it's just keeping an eye out for more information as it's released. So hopefully we'll be updating the Trust intranet with lots of information about how we can support veterans really soon. And there'll hopefully be some training appearing on iDevelop. And if you can just look out for that coming and try to keep up to date with it, then you'll be in the best position to help provide support for your colleagues and also for your patients.
Great. And same question really for patients then. Yeah, what would you say?
So I guess for patients, firstly, to be aware that you will be asked about your armed forces status. And if you're not, please do tell us. Please also speak up and say if you think that we can be doing more to provide you with support, and to ask for that support. Please also be patient. So we signed the charter in March. We're really committed to doing this work and to doing it well, but it does take a bit of time. So please bear with us, but we will get there in terms of having all the right information and processes in place.
Okay. And just finally then, I mean, there's plenty of other services available to veterans, isn't there? There's lots you can look at online, but anything kind of you would pinpoint them to specifically?
So I think first of all, one of the pieces of work we're doing at the moment is identifying the services that we can link in with really closely. And we've had our first meeting with the Poppy Factory, who support veterans with employment, and we're looking at what we can do with them. And then in addition to that, there are kind of 5 big national programs. So there's Operation Fortitude, which supports the armed forces community with housing. There's Operation Restore, which supports with kind of rehab, orthopedics, and physical health. There's Operation Courage, which supports with mental health provision for armed forces community. There's Operation Community, which is aimed at the kind of wider armed forces community, so that's supporting their families, but also serving personnel. And then lastly, there's Operation Nova, which is around the criminal justice system. And information about all of those is available online. And we'll be looking at how we develop our pathways so that we can link patients into those as appropriate.
Okay, excellent. Is there anything else that you'd like to add at all in relation to this at all that we've missed off?
Not really, other than to ask if there are any staff who want to be involved in this work, please get in contact with either myself or Sam Gorman. We have a Veterans Covenant Healthcare Alliance working group, which meets at the moment every fortnight. It'll probably go to monthly. And we're also looking to establish a staff network. So if you want to be involved with either of those, please get in touch with us and we'll try and filter you into the right kind of group to help support this work.
Yeah. Okay, excellent. Well, thank you very much indeed for Graeme for your time for coming on the podcast, and hope you've enjoyed taking part. Um, we'll be back with another podcast very soon, so keep an eye out for that on Buzzsprout or wherever you get your podcasts. And if you are listening and want to get involved in a future podcast, just email thh-tr.communications@nhs.net. Thank you very much for listening today. Thanks once again to Graeme for your time. Until the next time, goodbye.